Today, in Contextual Point, I'm going to talk about another high-yield concept for Step 2 CK, which is lifestyle interventions for hypertension. So, let's get started with a question. If we have only one option, which one do you advise to decrease blood pressure for a patient who has hypertension? Do you choose decrease dietary sodium or decrease alcohol intake? And same question, but this time, do you choose aerobic exercise as appropriate or DASH diet? Which one is more good, more effective to decrease hypertension? So the concept is based on comparison of lifestyle interventions. So this is the fundamental part of this topic. So we can count some lifestyle interventions for hypertension, and this list has an order which is really important to answer this question. So the first and the most important and most effective thing to decrease hypertension is DASH diet. DASH diet is a type of diet high in fruits, vegetables, and low in saturated fats. So this is the most effective one, but there is also weight loss, which could be most effective, especially in overweight patients, and sometimes most effective overall in some questions. So probably you will not see any question to compare DASH diet or weight loss. But please know these two are most important and most effective for decreasing hypertension as a lifestyle intervention. Third is aerobic exercise. And fourth is decreased dietary sodium, which is really important. So you need to know that DASH diet, weight loss, or aerobic exercise are more effective than decreased dietary sodium. You may see some questions and you get confused to whether choose should I advise decreased sodium or should over doing aerobic exercise or over advising DASH diet. So it's really important to know sodium is in the fourth. And the fifth one is increased potassium intake. This is not decreased, increased. So advising to increase potassium intake decreases hypertension. And I want to note that the increasing of potassium could not be able to doable in chronic kidney diseases, and you may see some questions about that, which is an interconnected field. But in the context of this topic, you would probably not see a type of question that are related to potassium intake, but after USMLE Step 1 become pass and failed, there's a lot of going on Step 2 CK, and I think in future there are a lot of more. There's a more challenging Step 2 CK we will see. So I advise you to know this one too. And the last one, and maybe the most important one, is decreased alcohol intake. So as you can see, decreased alcohol intake has least effect to decreasing hypertension. So please be aware of that, because you will see some questions to compare alcohol intake over sodium or alcohol intake over aerobic exercise. And you will get confused if you don't know this slide. And I just put some question for visual learners, so DASH diet and exercise on the top interventions, and decreasing alcohol intake is the least effective one. And last slide, I just want to describe how you can face with the questions in Step 2 CK. So Probably you will not see questions that are trying to assess your knowledge about comparison of DASH diet over weight loss, DASH diet or aerobic exercise, etc. But you will probably see to comparison of these three to these three. I mean, you could see some question to comparison weight loss over decreased sodium intake. So you now know weight loss is more great than decreased sodium intake in the context of decreasing hypertension. Or you would probably see two questions to comparison of inside of this tree. So decreased sodium intake has more effect than decreased alcohol intake. And increased potassium intake has more effect than decreased alcohol intake. So yeah, I'm quite sure you will probably see one or two questions on your step 2 exam about this topic. So if you like this video, please subscribe, and I wish you a great exam day.